It touched thousands of lives. It changed millions of fortunes. It broke new ground. It paved new paths. It wiped tears. It brought smiles. The story of Project Connect is a story set in real locations. There are no actors in this film. All characters are real, except that they are stars in their own right. The world's third largest number of HIV-infected people live in India. It's home to even 1/5 of the world's TB cases. The Connect project came to India in 2006 when the situation was much worse. Funded by USAID under the United States President's Emergency Plan for AIDS Relief, it was to stimulate a vigorous private sector response to AIDS and TB. It worked in Karnataka, Andhra Pradesh, Tamil Nadu and Maharashtra. The project was implemented by a group of organizations led by PSI, or Population Services International.
I think basically we had to face three key challenges. One was to make sure that we designed a program that made sense for India. Second, we had to create models. And third, we had to strike partnerships with the public sector as well as with the government sector to ensure that these models that we were developing could be then legitimized and spread across the country.
When ILO and RNTCP came on board as technical partners, it played an effective role in the world of work.
They could try out and also build upon the approaches and models which ILO had identified and developed. So I think that's a big achievement of taking the sketch from the drawing board to actually coming up with the model and also doing some experimentation and taking it beyond the workforce.
Connect used many innovative things to reach out to the public and private sectors. For instance, Connect partnered with Shahi Exports, a private sector company in Karnataka. It met with success when more than 850 master trainers, peer educators and senior managers were sensitized. One of the key partners was of course Visakhapatnam Steel Plant, a public sector undertaking. In 2007, Connect initiated a workplace intervention, making it one of the outstanding cascading models in the country.
PSI Connect was instrumental in not only the training part but also in the following up of the individuals in the departments, all the master trainers, and enable them to reach more peer educators, train more peer educators.
Today it has more than 2,000 peer educators, many who go beyond the walls of the steel plant to spread awareness.
We are fully committed, and to sustain our policy, we have already trained with the help of Connect about 157 master trainers. Already my company has trained about 50% of employees, and balance also we are focusing.
At the end of the day, Connect mobilized more than 500 companies to sign up for workplace interventions. As a result, it reached more than 260,000 employees.
Because of the involvement of PSI, many of the industries, even they call by name all the PSI people, and they used to interact with the PSI people directly.
In addition, Connect leveraged the Karnataka Labour Department to implement the national policy on HIV/AIDS and the world of work.
Over a period of time, the experience gained by the intervention of PSI Connect will help the departments to implement on its own.
But what was groundbreaking was reaching out to those workforces in the informal sector that were at a higher risk of HIV and TB. As many as 500,000 workers were made aware in the economic sectors that ranged from fishing, garment, construction, automobiles, sugarcane, chili, mining, truckers, focusing the bridge population. Often, the fear of stigma can hurt more than the disease. Sensing this, Connect set up 12 southern clinics, both static as well as mobile. These HIV counseling and testing centers sensitized high-risk groups in close quarters.
There was acute need of quality counseling and testing for the people who are afraid to approach the government center due to stigma and discrimination associated with there.
Out of the 130,000 people tested here, more than 5,000 were diagnosed HIV positive.
ఎవరైతే హెచ్ఐవితో జీవిస్తూ ఉంటారో వాళ్ళకి సైకలాజికల్ సపోర్ట్ ఇవ్వడం అనేది జరుగుతుంది.
The experience with the mobile ICTs was very good, especially when it comes to covering the HRG. They were very handy.
Southern Helpline that gave thousands of callers confidential counseling was transitioned to Mumbai District's AIDS Control Society. It's today called the MDAX Southern Helpline.
When we have tagged this helpline with our IEC activities, we have seen that about 600 to 700 calls per month we are receiving.
The project got wider audience when popular radio station Hello FM teamed up with Tamil screen icon Kamal Hassan to launch the Petrol Daan Pillaya campaign. This innovation was to raise money for providing health insurance for HIV-infected children.
He surprised us all when on the first day when he came to our office and announced that he's going to be giving 7.5 lakhs for the cause of HIV positive children. So that was the biggest start.
FICCI, or the Federation of Indian Chambers of Commerce and Industries, one of Connect's first partners, forged partnerships with the corporate sector for a national response.
This model has proved the policy dimension, the leadership dimension, the workplace intervention dimension, and holistically provided models of engagement and results.
Prevention of mother-to-child transmission or PMTCT services were almost non-existent in the private sector in India. 3 models of PMTCT were set up in private medical institutions, one each in Tamil Nadu, Karnataka and Andhra Pradesh. Here the overall mother-to-child transmission rate went down to nearly 2%.
Connect PPTCT na bittaku HIV free life ni ichindi.
In the initial stage, there was so much of dilemma and hesitance from our doctors and staff, but repeated training of Project Connect, they have no reason of such fear in treating the HIV positive women conducting deliveries.
Connect provided technical help to the state AIDS control societies in Andhra Pradesh and Karnataka to set up 49 public-private partnership models for PMTCT.
When PSI came with this project, we thought this was the time to help to make the private sector understand that it is very safe to operate on people or deliver women who are HIV positive if they take universal precautions.
The community engagement in the whole PPTCT response was exemplary. In fact, they created a community advisory board which had a variety of participation from the community, from Panchayat Raj institutions, from local doctors, from local politicians, from local community leaders, which actually gave a very big boost to the entire program, which not only drew people to the private sector but also it increased the credibility of the private sector.
Connect's biggest achievement, and probably one that will go down in history, was to engage the insurance sector for mainstreaming HIV in insurance. It facilitated to bring about India's first ever private health insurance product for PLHIV.
I can make all kinds of matchboxes and keep it in a shop, but there must be a buyer, you know. That is what the Connect did. They could identify, they could literally, they felt that it is their duty to do for that section of the society, and they have contacted us. They pleaded as if they are pleading for themselves.
The project's partnership with Karnataka Network for People Living with HIV or KNP Plus improved the insurance product to make it more sensitive to PLHIV.
It is a very benefit for us, particularly to improve our treatment behavior, seeking behavior.
Person whenever is admitted in the hospital and when he moves out of the hospital without a bill, then he is the happiest person to go.
The Dhan Foundation has incorporated a mutual social solidarity fund of 3.6 million rupees as a safety net.
This is also going to have a sustainable aspect for this entire project, and the project would continue not only in the district, it will be replicated.
At an international conference held in partnership with the National AIDS Control Organization and Health Systems 2020, it was concluded that HIV is a manageable condition and can be covered by insurance. NACO and the Insurance Regulatory and Development Authority actively came forward to endorse the need for mainstreaming HIV in insurance.
We kind of calculated based on a variety of secondary data that neither morbidity nor mortality rates are high enough to to affect profit margins of insurance companies.
With having crossed many a milestone, the Connect project has come a full circle.
I think that we've seen over the past 5 years that the project has had a dramatic impact in terms of some of the models it's developed that are now being scaled up, but also then the influence that it's had on national policies and programs.
Doing activities, the primary purpose of which really isn't to expand our own activities, but to hand over to the private sector and to the government lessons about how to deliver essential public health goods.
Connect showed us all the results, even when HIV was not seen as a health priority by the private sector. While the project was mandated to leverage $3.6 million, it mobilized nearly $5 million.
Despite the slowdown, the Connect project continued to deliver its results, and I think it's kudos to the teamwork and the innovative approach that the project used to show results.
I'd just like to really congratulate the Connect team who took on a really challenging assignment. How do you get the corporate sector involved in HIV and TB prevention? They've been enthusiastic, they've attacked the assignment with gusto, and they've had a lot of success.
The private sector in India is vibrant and growing enormously, and there are important lessons of how to engage with them for the government and our national programs. Thanks to all our partners, thanks to all our colleagues, thanks to USAID and NACO for helping us to make this happen.
Connect leaves behind a legacy. Whether you worked for Connect or Connect worked for you, either way, it became more than just a project to something you cannot disconnect from your very lives.
Connect was a champion.
A greenhouse of sorts.
Connecting people.
It's a team effort.
Positive energy.
Connecting network.
The right to access to insurance.
They were the pioneers.
It's an outstanding and noble thought.
A powerful initiative.
It's like an anchor.
Like a blessings from God.
It is the keystone.
Excellent services.
Don't disconnect, connect. Let it continue.